Good afternoon, everyone. What you were saying certainly was not irrelevant. You could have gone on. It's an honor for me to be listening to you. Thank you. Well, good evening again, and thanks to the organizers for giving me this excellent opportunity. I'd like to start with what Dr. Portaluppi said before when she closed the session. She said that this morning we were talking about a very small microcosm, oxidative stress and tumor treatment. So in a way now, I'd like to jump into the macrocosm and present what could in fact be a project considering all the things that we talked about, takes them for granted basically, and moves to a different level, a different approach, not micromolecular, but with the patient at the center. And perhaps you should know that I am involved in complementary medicine, complementary because it is a parallel to regular medicine, which we apply to various areas of our day-to-day activity. So I tend to avoid differentiations and barriers. In fact, the protocol I'm going to be presenting endeavors to bring together these two sides of the same coin. So to start with, let us wonder why it is that patients turn to complementary medicine at a time when their disease is so severe. Well, obviously, the first reason is desperation. It's a search for someone who can give them something more, certainties and hopes. And this is very difficult for a therapist to manage because unless we can treat and communicate with our patients, we might create false expectations with misdirected therapies, and this might not be in the interests of the patient, in the best interests of the patient. So the physician has to answer certain questions and therefore understand the efficacy of treatments and understand as well that treatment efficacy requires managing side effects. Sometimes side effects overload the general health status of the patient, and although they are side effects of therapy that may be going well, they may impair the patient's quality of life and also affect their overall ability to react to therapy itself. So the physician must learn, and this is what we're planning to explore, learn how to involve the patient, to engage the patient, manage the patient, and work in cooperation with the other therapists and physicians who are dealing with the physical or chemical aspects of treatment, so as to supplement, integrate the project, and turn it into something positive in general, not as an alternative to something else. And I think this derives from my own experience. I have a number of patients who are sometimes forced to conceal their therapeutic planning, their complementary medical treatment, because they hope not to lose their hair, not to feel depressed, etc. And if these are viewed by those who are considering a molecule, these are of secondary interest. But if we're dealing with people, which we are, men and women, human beings, that are experiencing a crucial time in their lives, then all these aspects like nausea are extremely just as important as the chemical or surgical treatment that they are going through. So these are aspects which, if you look at them just superficially, might seem trivial, but in fact these are 7 points that I think should be part and parcel of all therapeutic protocols, starting with diet. Then you have correct supplementation, and that's something we mentioned earlier, that is a highly selected quality of foodstuffs and dietary products to be taken. Correct hydration, this might also seem trivial, but in fact it's not. Oxygenation, nobody forgets to breathe, but the quality and quantity of what we breathe might be important. And then attitudes towards the patient involving movement, psychological support, and drainage, for example. As to diet, I'm not going to be talking about food because Professor Berrino will be dealing with that aspect, but it does have to be taken into very great consideration. And I say this not so much because I know what kind of food should be given to patients. I say it because I know and I study what food is eaten randomly. And if we believe that cigarette smoke can cause cancer due to its contact with our lungs, then how can it not be that the food we consume and reaches our intestines can be just as dangerous to our health if it's not good? 3,4-benzodiazepine. We're not the only people talking about these aspects. This is an important foundation talking about this checklist for avoiding cancer. In other words, not an early diagnosis, but actual primary prevention of cancer. So these are things that can cause cancer without being of genetic or viral origin. Supplementation, we've talked about that today. Essentially, we've said some very interesting things like we need high-quality supplementation. It needs to be understood. We need to know what we're administering to our patient. And I'd like to draw your attention just above and beyond the quality aspect, perhaps to the synergies involved. Oftentimes, it's not essential to supplement with just one product. When that's the case, we need to consider that there's something wrong. Food, diet, the use of herbs, plants, the use of products to enhance our health. Generally, we're talking about synergies. It's never just one element standalone. Iron, for example, is useless unless folic acid and vitamin B12 are also taken, and a whole complex that enables homocysteine to be digested. So in terms of supplementation, let me remind you of something that I've come across. There are AQT mice. There are AQT mice which genetically are homozygote recessive for yellow fur and thinness. So mating these mice produces obese and yellow-furred mice. Now, if certain substances belonging to the homocysteine family, vitamin B12, homocysteine, betaine, etc., are fed to these mice, for an entire generation of these mice, the end result was a thin mouse with yellow fur. In other words, it was proven in a study published in an esteemed publication that genetic information doesn't necessarily express itself unless the environment allows it to. Hydration, what can I say about that? It's hard to say drink more water or drink some water. We all know we have to. But I added it to my presentation because hydration is a very sensitive issue when we have to deal with it. Just to explain what I mean by detoxification, I sometimes tell my patients that our body has, during its life, has accumulated